I'm Dr. Ed Owen, and I've been a surgeon at Methodist North since 1987. Well, I wanted to be a heart surgeon ever since I was in the 9th grade. I wanted to be a physician since I was in the 5th grade, and later on in life, when heart surgery really started coming into its own in the late 60s, there were lots of exciting articles in the magazines and Time magazine about Dr. DeBakey and Dr. Cooley and others in the country, so I thought that was pretty exciting. And from that time on, I wanted to do that. So I think it's a great specialty, it's a tremendous lifestyle for me, and I think we do some good work for patients.
My name is Sam Wilson, and my heart was in good hands at Methodist North. Due to an infection I'd had when I was about 8 or 10 years old, the mitral valve of my heart was scarred and had finally slammed shut. And this was causing fluid from my blood that runs through my heart to be kicked back into my lungs, and that was what was causing the pneumonia.
Sam's valve became scarred down to the point of where it was tight and it was very difficult for blood to get through. So several years ago, he underwent a balloon procedure where a cardiologist inserted a balloon through the valve and opened it up. And that helped for some time, but subsequent to that, he continued to have problems with his valve that led to enlargement of the heart chambers in his heart, the right and left atria, which are the collecting chambers for blood in the heart. And over time, it affected his heart rhythm. So in addition to his valve problem, he developed a condition called atrial fibrillation, which a lot of people have.
I couldn't breathe, I couldn't walk, I couldn't talk. I was getting back to the point where I was falling asleep all the time, simply because I wasn't getting enough oxygen.
Sam's biggest problem was his quality of life. The mitral stenosis that he had and the abnormality of his valve certainly would have shortened his life by years. And so in addition to that, it shortens the life by causing progressive heart failure. And the heart failure with a valve problem can get to a point of where if you operate too late in a patient's condition, then it won't help them whatsoever. So we wanted to operate on Sam at the right time. So once he started to develop increasing symptoms such as shortness of breath and his heart started to show some enlargement, it was time to go ahead and operate on him.
If I had not had this surgery, I would probably be walking around with an oxygen mask on, possibly in a wheelchair. I would be alive, very possibly. But that's it. I couldn't work, I couldn't play golf, I couldn't go bowling, I couldn't go on vacations.
It really had taken up a good part of his life, worrying about his problems and thinking about it every day. And our goal was to get him to the point of where he didn't have to live a life like that, where he could go and live a normal life. And I think he has.
He's a nice man. He's a brilliant surgeon. He's probably one of the best doctors I've ever known, but he's a nice man. And a lot of times that counts more with me than the rest of it.
I think the care we offer here at Methodist North Hospital is the same as you would get in a big medical center. When I first came here in 1987, it was somewhat smaller and there was no heart surgery being performed here. And I think it was a great hospital. It's the perfect size, it's in a great community, and it offers easy access to a lot of the patients in this area. So we wanted to offer patients the chance to have complex heart surgery, which is usually performed in big centers close to their homes, so they can be close to their families also.
I love Methodist North Hospital. I have never received better treatment anywhere than I've ever been. My wife Lynn works here. She knows everybody here. I have never known a finer group of doctors, and better still, I've never known a finer group of nurses or attendants. And their main goal seems to be to make sure that everybody's well taken care of.